Welcome back to the Women's Heart Health Summit. This is your host, Dr. Mark Menolascino, thanking you for joining us to listen to the world's experts in women's health and in heart health to help you live a more vital, optimal life. Today, I'd like to welcome Dr. Joel Kahn, one of the world's experts in heart health. Hello, Joel, and thank you for joining us.
I'm excited to be here. I think we can really share some really good information.
Let me tell our viewers about you a little bit, Joel. Dr. Joel Kahn believes that plant-based nutrition is the most powerful source of preventive medicine on the planet. Having practiced traditional cardiology since 1983, it was only after his own commitment to a plant-based vegan diet that he truly began to delve into the realm of non-traditional diagnostic tools, prevention tactics, and nutrition-based recovery protocols. These ideologies led him to change his approach and focus on being a holistic cardiologist. I love that, holistic cardiologist. He passionately lectures throughout the country and the world about the health benefits of a plant-based anti-aging diet, inspiring a new generation of thought leaders to think scientifically and critically about the body's ability to heal itself through proper nutrition. One of the world's top cardiologists, Dr. Joel Kahn, has treated thousands of acute heart attacks during his career with angioplasty and stents. He'd like all that to stop. He'd like to prevent all future heart attacks by breaking through the public to educate and inspire a new holistic lifestyle. Now is the time for all of us to focus on education, to eat clean, sweat clean, and apply cutting-edge science to your lifestyle. Thank you again for joining us, Dr. Joel Kahn.
Let's jump right on in, and thank you very much.
Well, that's great. You know, as a physician, I'm impressed by the work you've done to get to where you're at, and the fact you've done thousands of angioplasties and stents in the heart catheterization lab, and now you've moved to try to never have to go in there again. That's a fantastic transition.
Yeah. You know, I love that phase of my career. It was many decades, and many people benefited, and very, very, very few were harmed. I'm very proud of that. But you know, I just kind of ran into this idea of preventive medicine, preventive nutrition early. So my patients were always getting two tracks: therapy they needed, preventive education, whether it was Dr. Dean Ornish's paper back in 1990 or, you know, now the internet. But when I actually trademarked the term prevent, not stent, and put it on coffee cups and T-shirts, my hospital administrators started to tell me, your days are numbered here. So I have a specialty clinic in suburban Detroit on preventive cardiology, much like your world famous clinic. And, you know, it's tremendously rewarding to see the progress people make towards getting actually literally younger inside.
Well, you know, we've been fortunate to have a lot of doctors that know a lot about nutrition, but you're one of my go-to people with a lot of respect for me. You have now 3 restaurants, is that correct?
Yeah, 2 in Detroit, suburban Detroit, plant-based organic restaurants called Green Space, and 1 is a food truck in Austin, Texas, right on the main drag. Kind of a fun little place because the weather's good all the time, so it's open all the time.
So not only do you talk about nutrition, but you deliver it in real time in a real way to people. I love that.
Well, so far I don't actually deliver the food to people's home.
Not yet.
We let Uber Eats do that, but yeah, I say I put my money where your mouth is.
Love that. I love that.
It was no small undertaking, and it's the restaurant business. It's not what Warren Buffett does for a living.
Well, you know, it's interesting. A lot of doctors that know about functional medicine, integrated medicine, they think it's a this or that. But for both of us, I know that when you need traditional medicine, or you need an antibiotic for pneumonia, or you need that stent to open up that heart artery in an emergency, good medicine is there and you have to take advantage of it. But the goal is really not to need it and not to ever have to get there.
Yeah, it would be foolhardy to say we're going to throw out all prescription and all procedures, because there's times they're life-saving. And so I do a very much, just as I said, you do too, a big toolbox. And I just go to traditional therapies a lot less than, you know, the standard doc of my type. And they're great people. I just, like you, found a path to get serious quality education. Once you've opened that Pandora's box, how are you not going to start to offer people, you know, such root cause, life-changing therapy? So it's the best way to practice medicine.
So Joel, for a lot of us, there was a moment where you knew you were going to transition, or as a patient or an experience? Can I ask you, what was that for you? What was that defining time in your career where you knew this was the direction you're going to have to move?
Yeah, I've always been a bit of a contrarian outsider, wearing cowboy boots in the cath lab, even though I'm from Detroit. But honestly, I started practice July 1, 1990, and 3 weeks later, in my home, in the mailbox, what we used to call a medical journal out of paper, it's all digital now, was the journal from England called Lancet. And there was an article by somebody I did not know, Dr. Dean Ornish. I'd been blowing things up in people's hearts for about 3 and 4 years, and now for 3 weeks on my own. And he's reporting he could clean out arteries with a lifestyle program centered on plant-based nutrition, which by that point I had been embracing personally for 13 years, plus stress management, some fitness, some social support. And I said, darn, this personal choice I made as a cardiologic, application that's in a major world journal. So it really was that moment I started teaching patients, whether it was just a copy of that article, I paperbacked that he published not long after, ultimately DVDs, internet, and then ultimately the fine training like you've had. You see, standing on the shoulder of giants to literally get the full spectrum. And increasingly and officially about 3.5, 4 years ago, I said goodbye to all traditional practice and now do really, as the joke is, holistic cardiology. People come in with a whole list of problems, and we try and have them leave with a whole list of solutions. So fun way to practice.
Well, at the end of the day, you're treating the whole person too. And probably no one more important than to look at the whole person than women's health. And
I agree with that. I agree. What's, sleep, stress, social support, friendships. I usually know the name of my patients' dogs or cats or where they vacation, and certainly know their nutrition and their sleep and the fundamentals.
So how do you start a relationship with a client? What are some of the first things that you want to know about when someone comes to see you?
Yeah. So, I do try the famous statement that a physician usually interrupts a patient in the first 30 seconds. I practiced in that 12, 15-minute medical model for many, many years. And you can get a lot of good done if you're efficient and caring. Nonetheless, now it's usually an hour per patient. So I try not to interrupt and all, but ultimately I'm going to ask the question, what drove you here? What's your greatest concern? What haven't we talked about? But I'm going to go through, I really go through breakfast, lunch, dinner, snack, soda, coffee, tea, water, home water purifier, home personal use, cleaning agents, dental health, silver amalgam, sleep, family history in detail. Are they taking supplements? Are they exposed to any toxins at work? Were they in China for a year during college? Pretty much the standard functional medicine framework of understanding them and stress. And then it's all about precision testing. So it's kind of not, you would hope that a heart doctor is about to put a stent in your heart, that it's the same precision of an engineer putting a ball bearing, in an axle, if there is still ball bearings and axles. I'm in Detroit, I'm not sure. But it's not so precise. So I try and practice through blood work, through imaging, precision cardiology, so I can actually tell a person you're anti-aging, you're actually younger than you were a year ago. It's delightful and possible, and actually not all that costly.
Could you share with us some of the new testing that you are doing in your clinic, and what are some things you're excited about with the new tests?
Yeah, I will do that. And maybe just as a quick little intro, patient I saw this morning, talk about gripping your heart. A woman I sort of knew in the community. I think my wife has walked dogs with her and such. But she came in, you could see just about to burst into tears. And I was not aware at age 47 that her 43-year-old brother had been found dead on his couch 4 weeks ago. Autopsy showed a 95% blocked left anterior descending widowmaker artery. Classic scenario. No warning, no symptoms proceeding. He actually had a big business, medical care. Her father had bypass, her grandfather had bypass. And, she was destroyed by this event, her very close brother. She was concerned for her own health, her children's health. And, that whole emotional combined with high-tech approach. Nobody had ever unpeeled her family to see what genetic, what marker, what cholesterol, what this or what that. And we'll go through that process over the next couple weeks. So it is going to be that long and extensive history. Physical exam's important. It's not usually the make or break, but it always is something I do. And then it's going to be very extensive lab work like you do. And I'm going to look at, advanced cholesterol, advanced inflammation, advanced nutritional values, some genetics that seem to be really important and have application. The beautiful thing about this, these are really quite available. My favorite lab, I won't name them, I will stay non-commercial, has now been bought and is the one that I use, I don't have ownership, is now available all across the United States. So you can actually get, state-of-the-art, highly advanced labs, and for the proper person, they're highly covered by insurance. It doesn't really segregate in those that can afford it and those that can't. There's just those that need it. Then I'm going to go beyond labs, usually to one of two cardiac imaging studies, because we have this very odd disconnect. We want to know if there's a polyp in the colon because of a family history of colorectal cancer. We do a colonoscopy. There's a family history of breast cancer. We do a thermoscan or a mammogram or an MRI. You have a family history of heart disease, you don't get nothing. And it's not intuitive. I mean, it's really crazy and sad, and people suffer and die because of it. So you can either do an ultrasound of the arteries to the brain called carotid arteries. I do the one called carotid IMT, intimal medial thickness, little fancier, a little more quantitative. And I can literally, I tell people every day, you're 62 years old, but your arteries are like a 47-year-old.
Very powerful, very powerful.
Wonderful. And more often the opposite, you're 62 and your arteries are like an 80-year-old, and we're digging into why, and we're going to work to reverse it. You can also do a CT scan of the chest that takes about 10 seconds without iodine, called a coronary artery calcium CT scan. Painless, very brief, very low. It is radiation, but very low. Very selective, and I don't repeat it. And you can identify this young man who sadly died 4 weeks ago would have known, had he had it a week or 2 or 6 months, that he was carrying a burden of calcified atherosclerosis. So, and then we sit down and make a plan. What do we got to do about your nutrition, your sleep, your fitness, your stress, any other lifestyle factors? What do we do with your labs? You have a methylation defect, you have a cholesterol defect, you have a vitamin deficiency. I mean, the ones I see all the time, vitamin D all the time, omega-3 all the time. Sometimes what we call the methylation, MTHFR. 20% of people, and you know this, Mark, but your viewers may not, 20% of people carry a kind of cholesterol that is genetically transmitted called LP(a) or lipoprotein(a). You don't say little, but it is the lowercase a. We need to come up with a better term, and it's just awkward to say it. The famous example was the fitness TV guru Bob Harper on The Biggest Loser show, along with Jillian Michaels. And last February, Bob Harper suffered a cardiac arrest at age 51, almost died, was on a ventilator in an ICU, had a massive heart attack. And a couple months later, he announced on the Dr. Oz show that he was unaware that he was carrying this genetic cholesterol, that for $22, your doctor can check it right today, tomorrow. You might be one of the 20%. 20% is 65 million Americans. And, then we get into the nuances. What do you do if it's very elevated? And that's something that medicine is still struggling with. But at least warn a person that, this is as much a risk to you as breast cancer and colorectal cancer and Alzheimer's and all the rest. So we're going to go through all that and come up with that program that will involve lifestyle, usually some supplements that have scientific evidence. Could be a prescription drug for cholesterol, blood pressure, blood sugar, until the lifestyle's right. And then we'll track it. Usually I use the carotid 12 months later. And
great.
I have the joy of telling people, you're actually like 8 to 10 years younger in the past 12 months. You've been working hard. I've been working hard. And here's the real data. So this is a incredibly powerful way to practice vascular medicine, cardiology. It's amazing.
Well, Joel, you just dittoed everything that I do on a daily basis. I know you and I are joined at the hip and looking at these advanced markers and in this personalized way. And they're easy tests to do. They're not invasive. You just have to know they're out there. So I encourage everyone listening to write down what Dr. Kahn just said and hand it to your doctor and ask for these. Why do you think more doctors aren't doing it, Joel? Is it that they're not aware of it? The patients aren't asking for it?
I think
No,
it's, you know,
I
it
don't
boils
understand
down,
why.
yeah. It boils down to education, and some don't know it's available, and I'm not criticizing any. They're studying other things. Some know it's available, but don't know what to do with the data. And I think that's the biggest leap, is what do you do with 7 pages of data, and what do you actually, how do you explain it to a patient? You'd
Yes.
be, you'd be looking rather silly to say, I ordered your TMAO level, but I don't know what TMAO is, and I don't know what to tell you to do about it. And then last step, not only, you know, knowing it's available, knowing what it is, then having some sort of therapy that, or at least identifying risk if there isn't therapy. So, I mean, I think you and I could create a short 60-minute video and, you know, bring that to a whole lot of, you know, medical practitioners and such. It takes time is the last aspect. So whether it's a physician assistant, nurse practitioner trained to handle some of this, that would facilitate it. Yeah. We do a great job of basic medicine. This, you know, kind of a higher level medicine is going to take a few more minutes.
Well, let's make that a goal for the two of us, is to actually get it out there like that. And
Okay.
I know you lecture internationally to doctors. I do as well. And I do think that, you know, this is for all the women watching. This is why your friend, who was an exercise advocate that worked out every day, had normal cholesterol, was lean and ate clean and had a heart attack. These markers explain why those people you wouldn't expect to have heart attacks have heart attacks. And people like Dr. Kahn can find them before they actually have them. Because Joel, isn't the first warning sign in half the people with heart disease a sudden death heart attack? You don't get a second shot.
Yeah, it's a very sad and accurate statement. You know, 2,200 people a day in the United States have a heart attack, and ultimately men and women are just, everything I'm talking about is very much geared to the female viewer of this important teaching series. I have sadly many women that are at the yoga studio, and they come in looking very fit, and they already have signs of plaque in their late 30s, early 40s. It's frankly scary. And then when you peel that onion and get into the advanced labs and all, I mean, they're not pulling into fast food restaurants. They're not, you know, smoking, but they may carry some of these genetic and hormonal and cholesterol markers, and you have to pull it apart. But yeah, so you're absolutely right. I mean, some people have called this upstream cardiology, upstream medicine. I mean, I tell people, I like basically telling you you're 3 weeks pregnant in terms of vascular disease. We're really identifying, I mean, we're really identifying it early. And I have to tell them, I'm actually talking about your health 15 years from now. And this is going to be tough. I'm talking about changing your diet, your fitness, your sleep, your emotional stability, taking some supplements, reordering your supplements, having lab tests, so that in 15 years, you're not in an emergency room. That's a lot for people to buy into, and it's going to take a rather proactive, focused person. And that's not YOLO. This is not YOLO medicine, you know. This is, you want to live long and well. And like you, I'm excited about anti-aging longevity medicine, but you're going to have to show up to that wonderful game, which is going to start bursting out maybe 5 years, 10 years, 12 years. You want to show up youthful and healthy to take advantage of it. So yeah, get checked. So women should have these advanced labs, particularly if there's any family history that gives a clue, but I'm pretty liberal even if there isn't. Maybe women should have one imaging study in their late 40s, mid 40s, whether it's carotid or cardiac. And, you know the score, as I say, test, not guess, with the #1 killer of men and women in America.
Well, that's the big point of this entire series is test, don't guess. The #1 killer of women is preventable, but you've got to be looking for it. And I love that you talked about the CIMT. It's an ultrasound of the neck, no radiation, non-invasive, easy to do, not expensive, reproducible, and you can watch people change over several years and actually their arteries de-age. That's fantastic.
I happen to have sitting on my desk, this is part of the result a patient gets, right carotid, left carotid. This happens to be a very lucky person where it says no plaque, no plaque. That's what you want. I don't see that all that often.
Right.
And down below, it's this measure of the thickness of the wall of the carotid artery. And this happens to say a 59-year-old whose carotid arteries are more like somebody 3-4 years younger. I mean, this is the kind of detailed precision you can do. When it's this good, you might not repeat it for a few years. This happens to be mine, so hooray, hooray.
Hooray, good job.
Plenty of others here that are loaded with plaque, but very quickly, within a year or so, you can see that improve. And it's not Drano, it's hard work and it's follow-up, but coronary disease is preventable and reversible, and vascular disease in a large number of people, but it's not an accident. It's, by design. I say young at heart by design.
Well, Joel, one of the reasons you're my favorite doctor is you walk the walk and talk the talk. So you just showed us your carotid intima media thickness. I've done my own calcium score 2 years ago. Thank goodness it was 0. But we're doing these tests on ourselves. We're doing particle scores on ourselves. We're doing these advanced testing. We don't want to have heart disease. We want to catch it. So we're making decisions on a day-to-day basis to take care of ourselves. Like you talk about nutrition, but that's how you live nutrition. That's what I love about you. You walk the walk and talk the talk. And being able to share that as a role model. I tell a lot of my doctors when I lecture to them, you've got to look the part and you've got to act the part. Make good decisions. Nobody's perfect, but you've got to be willing to model that behavior if you're teaching people how to be healthier. So I think that's super powerful. And thank you for sharing that.
I agree. It's very kind of you to say that. You grew up to the culture of nurses, doctors, stress, donuts, doctor's dining room, drug reps, pizza, chicken ribs. I mean, it can't be viewed as a logical one. And again, I understand my peers and I respect my peers, but come on. I mean, be concerned if you walk in your doctor's office and there's a bunch of 2-liter, Coke bottles and then you see donuts out. I mean, it doesn't mean leave, but at least speak up. I mean, I'm very vocal about hospital food as, you're in the hospital for your gallbladder. It should be a learning opportunity to say, wow, fruits and vegetables, whole grains, legumes, they don't have any soda pop. They're drinking, filtered water, and they're talking about, clean, healthy products. Look, they brought me some soap without parabens and without SLS and SES. And whoa, can you imagine what would happen for all the people that are in the hospital to actually walk out with some lifestyle education? Not the Wendy's and the Chick-fil-A I have in my university hospital.
Well, I remember the breakfast they were serving when they got the first meal after their heart bypass surgery was bacon and eggs and toast and a high-fat meal. So I didn't really understand that. And in my residency, Joel, we did 36 hours every 3 nights for 3 years. And at lunchtime, when the drug rep brought pizza, it was how many pieces you could get down you before your pager went off. And I put on 30 pounds. My blood pressure went up. I was probably mildly depressed. The training that we're doing is not healthy. And we got 20 minutes of nutrition disguised as scurvy and rickets in med school. But it seems to be changing. Are you seeing that too, where we're getting healthier resident habits? We're teaching nutrition in med schools?
Yeah, the largest med school in the United States is in Detroit. I'm a clinical professor at Wayne State University, and we're creeping. In fact, they'll only let me talk about nutrition and particularly plant-based nutrition in the form of a debate. They're very concerned it has to be balanced. That's fine. I meet good colleagues in the School of Nutrition that way, and we have to kind of come to agreement around the Mediterranean diet or just lots of fruits and vegetables. The message resonates. I'm not there to promote only a single viewpoint. It's increasing. It's still, cardiology fellows get nearly, you think about it, no nutritional education because it's not on the cardiology boards. So there's absolutely no need to take an hour a year away from teaching about stents or congestive heart failure, end stage about to die illnesses. So when the boards, and I don't know when this is going to happen, include lifestyle medicine questions, then training programs will include them. Now, I want to back up just for a minute. We're talking about advanced testing and test not guess and how you get these scans. It's all based, unfortunately, on the fact you can do a self-exam of your breast and find a lump. You can't do that for cardiovascular disease through most of its extent. Sadly, as you said, 50% of this first sign of cardiovascular disease is being dead on the couch like this lovely woman's brother 4 weeks ago. And that's women and men. There's really not much difference in terms of the frequency of that. But this is a disease that slowly and progressively builds and builds with no symptoms. So you women, you're playing tennis, you're working as executives, you're doing Pilates, you're doing bar classes, you're hiking, you're raising families, you're acquiring companies, you're a lawyer, I don't know, you know, you are probably developing plaque, and it is sadly not safe to assume, you know, I just ran 6 miles or whatever the endpoint you're choosing. Feeling good is wonderful, but you may be aging in a way that can be measured, can be quantitated, can be the source of it usually identified, and can set up a program to reverse it. So, you know, the classic symptoms are tightness, squeezing, pressure, oppressive feeling on exertion, in cold weather, maybe during emotion or sexual activity, goes away in 2-3 minutes. That's called angina. We believe women have slightly a range of symptoms a little bit broader than that. Sometimes just sweating, some exertional nausea, exertional shortness of breath, exertional back pain, exertional palpitations. It's still usually brought on by something that is driving the heart rate and the blood pressure up, like physical activity, sexual activity, cold weather, emotional upset. But you don't want to necessarily wait, because that is the end of the game. And then maybe you catch it before the heart attack, you end up with a stent. But you want to catch it, as I say, the 3-week pregnancy, so that you have an opportunity to never be that person 15 years, 10 years down the road in the emergency room.
Well, you bring up such a great point that women are different than men. The way they show up with heart disease and heart disease symptoms typically isn't the painful crushing on the chest. It can be nausea, it can be heartburn, it can be malaise or fatigue or depression. In my residency days, Joel, we had a woman who came in for digestive nausea and some vomiting, and her gallbladder looked like it was thickened on ultrasound, so she was scheduled to have her gallbladder taken out. And as we rotated our residents, I came on shift, and I said, well, you know, women kind of present differently. What's her EKG look like? It had never been done. Turned out she was admitted 2 days earlier and had a heart attack, and her heart was going through the evolution of dying essentially for 2 days. And if they'd taken her to surgery, she most likely would not have survived. Interestingly, her cardiologist said, you're now a cardiac cripple. A woman who formerly jogged, her squeeze function of her heart was damaged, that he was told you wouldn't jog. And then there are tricks like CoQ10, carnitine, some of these things to try to recapture some of the muscle. What are some of the things beyond nutrition that you use in your clinic, or that you think may be beneficial for women to look at to boost their heart function if they've had a heart problem, or to help protect them?
Yeah. So, I mean, pre-heart attack, and, you know, again, there are prescription drugs, blood pressure, blood sugar, cholesterol. Some can be used very safely and may be needed. I will say, there's a philosophy that I ascribe to in cardiology. Let's take statins like Lipitor, Zocor, Crestor, Livalo, Livalo. You may have heard some of these, of course. I mean, I will not place somebody on those medicines, whether it's 3 days a week, 5 days a week, low dose, high dose, until I know you have disease and I've quantified it. The majority of women receiving a prescription for generic Lipitor have no idea if their arteries are clean or are aging. And there is a society called the SHAPE Society, Cardiology Preventive Society, that says that's just wrong. Step one, get the ultrasound, get the CAT scan, do the labs. If you're a person actually developing atherosclerosis, then that may be reasonable. But to treat a person with clean, youthful arteries with a prescription drug that blocks an important enzyme pathway, it has been said to be like giving chemotherapy to somebody without cancer. That's a famous quote by a cardiologist last year that engendered a lot of controversy. So, I mean, step one, you know, evaluate the need for prescription drugs. They're not always bad, but they are overprescribed, assuming you have disease. You may not. There are healthy people out there. Number two, pre-heart attack, I love natural approaches for blood pressure, cholesterol, and blood sugar control. I like berberine, I like bergamot. These are plant-based compounds that have good science, have multiple pathways that they either interrupt blood sugar metabolism or cholesterol metabolism, for the better. A big fan of pretty much magnesium for everybody. Should be getting that mineral from our food, but even good plant strong diets grown in conventional farming are much lower in magnesium. You know, an apple now versus an apple in 1920, they look the same. There's 85% less magnesium in your spinach, in your apples. So some magnesium, whether it's just a simple little powder you buy in the drugstore, whether it's a nice chelated magnesium capsule before bed, whether it's an Epsom salt bath, will help naturally if you have any PMS symptoms, migraines, blood pressure, palpitations, blood sugar control. I love people on magnesium. They usually enjoy it, any constipation. I'm a big fan of coenzyme Q10, probably a little bit, perimenopausal and beyond, a natural antioxidant energy substrate you're very familiar with, that we make abundantly till we get into our 40s and 50s, or we get on a cholesterol medicine. A very safe supplement. If you get into your 70s, there's actually a randomized study in Sweden that suggests it may help extend life and have a very solid, scientifically supported anti-aging function when combined with antioxidant called selenium, or a cofactor called selenium. So I'm I can usually really help a person with migraines, blood pressure, palpitations, fatigue by using magnesium coenzyme Q10. I'm going to know the vitamin D level and replace it usually if low. I check omega-3, very hard nutrient in my clinic to really see people whether they're plant eaters, where omega-3 is coming from flax, chia, hemp, walnuts, greens, whether they're quote omnivores, if they're eating fish 4 to 5 times a week, their blood level of omega-3 may be great, but they might have mercury in their blood. Unfortunately, in the world we live in, my meat eaters have very low omega-3 levels, and it's so important for brain health, for cholesterol, for blood sugar. So I will measure, and very often, I'm not giving out omega-3 to all. We've had the pendulum swing back and forth. There's fish-based omega-3. There's algae-based capsule omega-3 now that are very clean and getting more and more potent. But we've had some reminders recently that there is a role for proper supplementation and getting levels of omega-3 out. After an event where you've really suffered after a heart attack, there's a whole protocol to try and strengthen the heart. There's some, I don't know how much, Mark, you use. I use actually a lot of maca, specialized maca, a South American root vegetable that has some cortisol and sexual hormone balancing impact that I'm seeing my men's testosterone go up, and symptoms and hormones in women seemingly respond favorably, and some drop in cholesterol without having to reach for the prescription pad. So those are probably the mainstays of what I do, but all other kinds of options to think about.
Well, you mentioned maca, and that brings up a great point, as do the omegas. One of my pro athletes came in a couple years ago, and he said, Dr. Mark, I can't take that fish oil because my girlfriend can taste it when we kiss. And I said, well, show it to me. And it was a big box store brand. He held it out as he opened it because he didn't want to have to smell it. It was rancid when he bought it. Yeah. And I said, my gosh, you make $20 million a year and you're buying wholesale warehoused rancid fish oil. So I gave him a high quality. He called me a couple of days later and said, she doesn't even know I'm taking it. So quality really is king when you talk about these supplements and all the toxic additives. Fish oil might be the biggest culprit in low quality supplements. Then things like maca, these really unique supplements, you've really got to find a good source for them. So all maca is not the same, all CoQ10 is not the same, all omega-3s. Joel, can I ask you, I'm sure you get asked this a lot, what kind of fat should I eat? Fat's been supported, it's been berated, there's so many different kinds. How do you make it easy for your clients to walk away with actionable information on that?
Right. So I often get pigeonholed as a low-fat advocate. I personally eat a completely plant diet. And if you eat a completely plant diet, it is often naturally low in fat, unless you're adding added oils, because sweet potatoes, they all have a percentage of their calories that are from a fat source, but it's going to be naturally low. The island of Okinawa, which is in the Japanese chain, is very famous for having the greatest longevity on the planet, the greatest health into their 80s, 90s, and even beyond 100. And their diet is less than 10% calories that come from fat because they're eating sweet potatoes and they're eating root vegetables, and 3-4% of their diet naturally comes from animals, and fish particularly because it's an island. So you can exist, and there are communities, Loma Linda, California, that have exceptional health and relatively low percentage of calories from fat. So it's not necessarily a harmful or a unnatural way to live. We have these communities. But you can also have a percentage high. The most poignant example, and then I'll give some specifics,
Please.
is in about 1970, the country of Finland had the highest heart attack rate in the Western world. 42-year-old men, lumberjacks, out there working hard, dropping dead of heart attacks. It was actually a major economic drain on the country of Finland. 40% of the calories eaten by an average Finn in that time period was of fat calories, 40%. The island of Crete in the Greek chain had the lowest heart attack rate in the Mediterranean basin. 40% of calories in Crete in 1970 were from fat. So obviously just the gross term fat can't define your risk for a stroke and heart attack. The difference was Finland was rich in cheese and salami and butter on a sandwich, and most of the calories from fat in Crete were from very fresh homegrown olive oil. And one is a plant-based source, one is an animal-based source. So there's quite a distinction now to legitimately talk in the science world about fats that derive from plants, which could be avocados and nuts, and oils from those products, and fats that derive from animal sources. And I think the divergence, a paper earlier this year, take a fancy word, monounsaturated fats, when coming from animal sources, which are surprisingly, there's a lot of omega-9 in meats, particularly, they actually were associated with a higher risk of mortality during a 20-year period at the Harvard School of Public Health. And people that ate monounsaturated fats, olives, nuts, olive oil, had a lower risk of mortality during that period. So we're getting wise, and the idea that all people need to eat low fat has really never been the official recommendation. The government allows in their recommendations a tolerance for fat. The single exception is my field. People come to me, Doc, I had a calf in Ann Arbor, Michigan. I'm 90% blocked. They want to do bypass. They want to do stents. I feel great. I've read the books. I've seen forks over knives. I want to try and avoid these procedures. Is there a diet and a program? And really, the database is from Dr. Dean Ornish and Dr. Caldwell Esselstyn, to some extent, Dr. Joel Furman, that you want to eat. Actually, Furman's a bit of an outlier because you will have a bit of a higher fat percentage in that program. But you may be able to stop and actually reverse serious plaque by adopting this Okinawan diet, a diet that's naturally very low in the percentage of calories derived from fat. Certainly skip the butter, the cheese, the salami, but also skip the oils, eat beans, eat peas, eat lentils, eat salads, eat whole grains, eat fruits, and create a beautiful and very tasty kind of gourmet way to live. And you'll actually have a very high chance of improving and seeing stress tests improve and have a wonderful life without surgery. So I have dozens of patients who do choose to eat a no added oil, naturally very low fat diet, but it's for a specific therapeutic benefit. I was at an Italian restaurant last night having a gourmet plant diet. I know where their olive oil is from. I know the city in Italy it's from. I know the owner. That was a rare exception. There was oil being splattered all over, but I mean, I was going to enjoy that. That's unusual, but it's certainly compatible with a healthy lifestyle.
So it's not just what it is, it's where it's from, and it's the quality of it that you're really getting at and finding a balance. Joel, I've got to ask you, because I know so many people ask you about diets. They come in and say, Dr. Kahn, what diet should I eat? What about the intermittent fasting diet, the ketogenic diet? How do you engage with people, or where do you like to steer them when they try to get you to prescribe a diet for them?
Okay. So, I mean, I would encourage anybody to go to a website probably you've never heard of, because I am actually, despite being on the web and debating and to some extent fighting a bit, there's a tradition of Dr. Ornish debating Dr. Atkins and Dr. Ornish debating Mr. Gary Taubes and these divisive.
I think it's very healthy, Joel. It's a discussion. It's good for all of us to hear.
I was involved in one last week that, several million people have viewed. But at the end of the day, we have to, provide some consensus. So there's an organization called TrueHealthInitiative.org, TrueHealthInitiative.org. More than 400 professors and doctors and scientists from every spectrum of the dietary approach all over the world. And they have a pledge. And the pledge says we're going to eat plant predominant, close to nature, meaning unprocessed, locally sourced, meaning as much as you can, not having your broccoli shipped from 3,000 miles away, drinking predominantly water. Those are the 4 pedestals plant predominant, that leaves a percentage of, your choice of protein. Mine are beans and yours could be otherwise. Locally sourced, close to nature, and unprocessed, and predominantly water. I'm good with that. Harvard School of Public Health has a food plate. Anybody wants to Google 2011 Harvard School of Public Health food plate. Very happy with the wording and the discussion, and milk went away. There's water. There is olive oil there, but again, choose very high quality. Just to wrap up what you were asking me about, people find that boring. I mean, how often can you tell people eat your fruits and vegetables? There has to be something new to sell a book or make a headline or clickbait news. Right now, it's the keto diet. 5 years ago, it was the paleo diet. Ketogenic, this idea, you drop your carbs down to the minimum, you drive your fats up. Some people drive fat and protein up, which may be a particularly dangerous approach to it. So, you're adding, meats and butter and oils all over, so that maybe 80% of the calories you eat are derived from fat sources, usually animal-based fat sources, and you will activate it in an Atkins diet-like way, so water loss, losing your glycogen, you'll see some weight come off, you'll fit in your dress for a wedding a little bit easier. You might get a little mental clarity out of it by shifting some of your fuel substrate from glucose over to ketone bodies. But what I object to is I have friends that tell me, I'm keto 4 years, I've been keto 3.5 years. I don't know if they are or not. You can buy little test strips at the drugstore and actually see if you're producing these reserve fuels called ketone bodies. But there are 8 or 9 scientific studies that say there's a significant price you might pay for that, because these studies say the mortality of a group of people saying I eat a low carb diet is increased over those that say I enjoy whole grains and legumes and beans and peas and lentils. So, I mean, mortality is a pretty bad outcome for fitting in a dress. Do it for a week, do it for 5 days. There is now a growing interest in the research world and clinical world, so-called plant-based ketogenic diet.
Yes.
You can do this with big plates of arugula and lupini beans. Lupini beans, you can buy them on the web. They're very kind of low-carb, tasty little beans. I have a whole bunch in my drawer here in my office. I eat. They're delicious with avo oil or olive oil or such. You can do this. There's a program out of University of Southern California. You're familiar with, Mark, the fasting mimicking diet. It's 5 days of a low carb, low calorie, ketogenic play. It's all plant-based. Probably got more research than any other ketogenic diet. But at the end of 5 days, you go back to a healthy diet and you periodically stress your body, come back and recover, stress your body. Remarkable scientific.
Looks good. Looks good.
Many, many, many of my patients have broken through the wall of not losing weight or not bringing their blood pressure down or not controlling their urges. And, living on 800 calories a day out of the University of Southern California fasting mimicking diet has really enlightened them to get control and enjoy the benefits, actually physiologically anti-aging themselves with food.
Joel, you talked about our nutrient depleted soils. How do you see toxicity in heart disease playing out? And is that becoming a bigger concern for you with our toxic foods or toxic medicines or toxic soils, toxic water?
It's actually a fascinating topic, very relevant like right now. So, you're aware, I'm aware, there's shreds of data about heavy metals. So, there's no role for health to have mercury in your body. There's no role to have lead in your body. They're never healthy. We're all exposed, maybe more so when it was lead paint and lead gasoline, but it's still all over the place because we've got these pipes bringing water to our house or our business. Or in Detroit, Michigan right now, the pipes bringing water to public schools are so laden with flakes of lead coming off of old pipes, they've had to turn off every single drinking fountain in Detroit public schools in the last couple of months. So we are exposed, and these are easily measured in urine or hair or blood tests. In the last maybe 6 months, there was a massive study reported that up to, this is an amazing number, 200,000 cardiovascular deaths a year in the United States are related to lead exposure. This is a big, massive study of lead levels and cardiac disease and all. Lead may raise blood pressure. Even subtle increases in blood pressure over time can damage arteries, increase risk of stroke and heart attack. Lead may raise cholesterol and be a factor in why, despite some good effort, cholesterol's still up. And even in the past month, there's been a second study relating exposure. This was cadmium, arsenic, mercury, lead, a little broader profile of a heavy metal exposure. You might get arsenic from rice, arsenic from chicken, arsenic and glyphosate from some of the cheaper wines and drinks. I'm very, very picky about where I get my wine because,
Smart.
you know, if they're spraying pesticide all over, it's no different than, you know, buying a poor quality, you know, piece of fruit or piece of meat in the market. We don't think of wine. Wine is the one food that's completely unregulated by our FDA. There's no need to label it, you know, and all, and it's kind of concerning. So
Yes.
I drink European wine exclusively because they are tighter about pesticides and use of Roundup on farming. So yeah, that's one area of toxicity that hasn't yet infiltrated into practice. I mean, most cardiologists aren't checking and aren't discussing it, but the database is very strong. Then you get into, we call these, you know, you got a sophisticated audience of women, the endocrine disrupting chemicals, you know, whether your facial lotions and your shampoos and your toothpaste and your cleaning agents are from, you know, more organic and are free of these additives or not, because they'll be in your body. And fertility issues are more and more being attributed, weight issues, diabetic issues, real science, really making mainstream. I just checked my urine glyphosate level because it was a little research study. I could send a sample. So we all have a little. You can't run Roundup, but I had a really low dose of, I try and eat organic. My restaurants are organic, which is where I do a lot of my eating. Yeah, so I think the environment, and the big one, and this is the toughest one, water quality is clearly an issue, and I would encourage people to think about some sort of either desktop or whole house, either reverse osmosis or filter system. But actually, air pollution has come on, and that's the tough one. What are you going to do? Because you got to breathe. You can control in your house, maybe with a home air filter and such, but air pollution and mental health, cardiovascular health, weight issues, as scientifically a booming database. How do you respond and counsel your patients? I mean, don't go jogging next to an 18-wheeler would be a good piece of advice. Maybe don't go outside and exercise on a smog day in Los Angeles if you live, you know, in LA or the Valley, like they had 80 days in a row of smog alert. You know, it kind of dampens your lifestyle, but it's serious. So if you're going to do those things, at least have the rest of your life very clean, very organic, sweat, use infrared saunas, hydrate, take chlorella, eat arugula, eat cilantro, and take some measures that are reasonable and maybe quite protective.
Boy, those are all good life lessons, life measures. That's why I live in this place behind me and raise my kids here, because it's not that concerned, but it is everywhere. When I got certified in anti-aging 20 years ago, we were talking about mercury and arsenic and lead and cardiovascular risk. So it's great that it's really come in the forefront, and Joe Pizzorno teaches us, maybe related to all type 2 diabetes. So Joel, I love that you're on the forefronts, that you're walking the walk, you're talking the talk, you're serving the food, you're eating the food, drinking the good wine, fighting the good fight. You're one of my personal heroes of medicine. I so appreciate you being here today, and thank you so very much.
Wow, so kind of you. And listen, I mean, really what I want everybody today is to actually put this into action. You know, find a book, a website where you can find out about where CIMT is done in your community, where you can get a heart CT scan, where you can get advanced cholesterol and hormonal and inflammation labs. And, you know, get it done. Get it done before the end of, you know, this month. And find a practitioner like Mark, Dr. Mark in your community that can help you put together a plan. Because, you know, there's that statement, you know, and Mark, a person with health has 1,000 dreams. A person with poor health has only one dream. And, you know, life, when you feel good and you have all these dreams, is a great place to live. So I have you join me and Dr. Mark getting right in that sweet spot of life.
Great. Well, thank you so very much, Dr. Joel Kahn. And Joel, if people want to learn more about you and your messaging, how can they find you? How can they connect with you?
Yeah, Dr. Google will find me. I'm all over the place. But I do have a website, drjoelkahn.com, drjoelkahn.com. That takes you all over the place. But I'm on Twitter, I'm on Instagram, I'm on Facebook every day, and I'm pretty active.
Fantastic. Thank you again, Dr. Joel Kahn.
Thank you.